thank you so much for joining me today to talk on the podcast. We're here to talk about, well, your PhD research and a bit more specifically after that around this great review you've done around stress management and behaviour change interventions with nursing students. If it's okay, just to begin with, would you like to just introduce yourself and maybe talk a little bit about your background in nursing and your qualifications after that, and why you got into this kind of research area?
Yeah, brilliant. So thank you very much for having me. So my name is Becky. I am a PhD student at the University of Winchester. My nursing career started, I was a healthcare support worker for 2 years in elderly care. So that was doing palliative care and rehabilitation. I absolutely loved that, developed a real passion for nursing. So I then went on to study child and adult dual field nursing at the University of Southampton. Again, absolutely loved it. And one thing that really stood out to me was that I was really well supported. I had a brilliant academic tutor. I had really supportive supervisors on placement. And so I managed to make it through. So because I was dual field, it was a 4-year course. I made it through successfully. However, many of my peers didn't. Many of them struggled with their well-being. And it really made me reflect on why. Why was it that I managed to get through, and some of my peers have had to, unfortunately, for a variety of reasons, stop their programs. And I also was very passionate about research. I did a lot of research activities on the side of my Bachelor's of Nursing, and that led me to do a master's in psychology. So I went to the University of Surrey and I completed the psychology conversion course there. And then I was very lucky to be offered the opportunity for a funded PhD looking at student nurse wellbeing. So I was very keen to accept, and I went on to create the question of what are the necessary components of an intervention to improve the wellbeing of student nurses. So I've been studying this for the last 3 years, and I have conducted a systematic review, which we'll be discussing today. I've also conducted a case study, and I've also gained some stakeholder feedback on the intervention components I've suggested. And I'm really happy with the outcome of my PhD, and I feel I've got some really great findings that I hope will contribute to this area and hopefully improve the experience of student nurses.
Amazing. And I guess I'm interested, so this research project emerged to look at the effective components of wellbeing programs. So do you want to just talk us through a little bit around why that emerged as a research question? What was the kind of problem before that led to that sort of question needing to be answered?
So I think one thing is that student nurses are individuals. They are people in their own right. They will have a variety of personal things that will influence their well-being. They'll have a variety of organizational things that will influence their well-being. So that means that there's not going to be a one-size-fits-all intervention on the individual level. However, universities also vary. So what happens in student nurse education is that the Nursing and Midwifery Council regulates student nurse education, and they provide standards that universities have to meet in order to be able to have students who will become registered professionals with the NMC. However, the way universities decide to implement that is going to vary, and therefore the stresses students experience are going to vary as well. So it'll be really hard to have a very specific and bounded intervention that's going to work in every single setting. By taking the approach that I've taken, and I've created sort of a checklist of student nurse wellbeing that is based on 3 components I've found to be necessary for an intervention, which is a component to reduce the stresses experienced by students, a component to increase the support provided, and a component to help them cope with the inevitable stresses they will encounter during their studies. And by doing it this way, the universities are then able to reflect on their own course. Individuals can reflect on their own lives. And that way you get that degree of fidelity to the intervention. And by that, I mean that the core components are being implemented as I suggest, without it being really, really rule-based and narrow in how it needs to be approached.
I love that. So yeah, it's providing that flexibility, isn't it? It's kind of guideline and flexibility. I think, as we were discussing before, all too often people kind of try and use this one size fits all. People jump on an idea that seems to be effective and try and apply that to everyone. It's like the sort of using the hammer to was it, what's that saying? Thinking a hammer is the right tool to hit, approach every problem, basically, right? Actually, you need different tools, don't you, and different approaches. So yeah, I mean, really interested, just going back to your own experience. You mentioned that you had really good support, which was one of the things which helped with your own well-being. Is that something that you noticed with your colleagues as well, that people sort of, they didn't get as good mentorship and supervision? Was that one of the contributing problems, do you think?
I think so. I was on a dual field program, which meant within my specific course, there was only 12 of us. That dropped to 10, but 2 of them had very extreme individual circumstances, which led to them withdrawing. But what that meant was that my tutor group was only made up of 10 of us. So that meant my academic tutor had more time for us. When we met as a group, it was very much, we got on really well. We were a sort of a group of 10 who were really cohesive. We could support each other. It was a very safe environment. Now, if you're looking at a program such as adult nursing specifically, they will have huge tutor groups, and there's also quite a lot more variation in terms of staff leaving, staff joining. So there's not that continuity of support. So their academic tutors, I think, were just so overworked. They didn't always have enough time to provide that support that was necessary. I also think I was lucky to have great peer support, whereas sometimes that's lacking if you're in such a big cohort. And then on placements, I also often got on with my supervisors, and that was key because it meant even if there was a very stressful environment, for example, the emergency department is overrun, as we all know, the NHS is really struggling, but because I had supportive supervisors who, for example, would always debrief me at the end of a day if it had been really hard, if I'd been through a traumatic experience or something, they would always spend sort of 5 minutes working through that with me, allowing me to reflect, which meant that I didn't sort of panic when I got home as to how I was going to cope with the impact it had on me. So I think a part of it was probably that I was just incredibly lucky to have had that support put to me, but I also think I made the most of it. So I would say when I was struggling, and I think some of my peers didn't feel able to do that, whereas I was happy to send that email and say, look, I'm having a tough time, can you help with X, Y, or Z? And 9 times out of 10 they were able to help.
Yeah, again, it's this kind of complex interaction, isn't it, between the support and resources that are available and individual kind of responsibility and the way we interact with that, isn't it? Because you're a person who was more willing to reach out for the support, and the support was there, and those two combined to give you an experience in which you felt nurtured and supported, and that obviously helped carry you through, and ultimately, I guess, grow from those experiences. Whereas other people might not have the support, they might not necessarily have the individual inner resources or willingness to reach out, and it's quite complex, isn't it?
I think on that as well, in my research, some students have said that they feel judged when on placement. And one quote that really has stuck with me is they said, I feel I'm expected to be inhuman. So things aren't allowed to affect me. I'm not allowed to have difficulties. And because they were saying they kind of want to seek help from the people who were going to be assessing and judging them, they felt like the expectation was they just got on with it and they couldn't speak up. They couldn't complain because they were worried about what people would think of them. And I think that to me says that lack of authenticity, that lack of ability to really be true to who you are or to seek help is going to be a huge barrier to helping students with their well-being. And I think that's a cultural thing. We need to be able to encourage students to seek help when they're struggling, and not to be a weakness, but actually to be a strength, to say, look, this is going on for me. I really need help in this area. And then for the help to be there, as you say.
Yeah, and of course that has to be modeled by leaders, doesn't it? That vulnerability, and sort of demonstrating that it's okay to speak up about things and to ask for help, and not kind of creating a culture of perfectionism and everything has to be perfect here and we can't make mistakes, and I guess a shame-based culture often kind of will extinguish anyone's willingness to sort of speak up about things, because if there's an implicit expectation that they're going to be judged as being inferior or not good enough, basically, which I imagine, as we were talking about before, identity and trying to become the right kind of nurse is something that those young students, well, I suppose not all student nurses are younger, but just student nurses are trying to sort of navigate that kind of complex identity shift. And
I think one question I asked the student nurses in my research is there a difference between your personal and professional identity? Now, this was only answered by 45 students because it was at a case study. So 87% said, yes, my personal and professional identity are different. I then asked, does this difference influence your well-being? And 56% said, yes, it does. And what I found was that those who said that difference between their personal and professional identities influenced their well-being were basing their professional identity on external things, such as what others thought of them. Those who felt that it didn't influence their well-being were very much based on internal things like values, or who they were as a person. And I found that so interesting because that gives us such great scope for intervention to try and get someone to think about, I guess it's acceptance and commitment therapy in the way of values-based living, rather than focusing on how they're being perceived by others.
Yes, I mean, as we were talking about before, like, I think we're both really big believers in that, aren't we? And being guided by our values, that kind of inner guidance system basically is so important. And it's really interesting because, you know, we're talking about this idea of stressors, and it almost sounds like it's an existential stressor, isn't it? This whole thing of like identity, and not necessarily one that, without speaking to people like you have, actually asking the questions and really getting into people's minds about it, you wouldn't necessarily uncover that, would you? As a kind of important stressor that we need to consider and work on.
I think it really speaks to the value of mixed methods research. Just from a very researcher's perspective, like my systematic review was very quantitative. That was focusing more on data as such, quantitative data, whereas my qualitative work, my qualitative data gave it the depth and the nuance I needed to really understand the student experience. And I think that's one of the things we need more in this area, is actually speaking to people, because you can only know so much from a number. Like, it's really hard to be able to understand their lived experience if you're focusing on a statistic.
Absolutely. And I think I find that myself when I'm looking through the research literature, looking at things that are centered around nurse wellbeing and mental health, is that it's, you know, it's great to have a paper that talks about the epidemiology of something, or the quantitative data, but then actually backing that up and triangulating with people's experiences is really essential, isn't it?
Mm-hmm.
And because not everyone's the same, and I don't know, yeah, it's great that you've done that. So one of the key kind of contextual factors then is this idea of attrition, isn't it? So nurses leaving study but also leaving the profession. So do you want to just talk a little bit about that sort of background contextual factor then, and why this stuff is important?
Yeah, definitely. So the figures of attrition for student nurses, and I know attrition varies in the definition, but essentially people who are not completing their program. So these are students who start the program and then do not finish. So it is very variable, but there was a big study called the Repair Project, and this was by Health Education England and Professor Mary Lovegrove. And it was looking at attrition throughout a variety of healthcare education programs. So we're talking radiology, nursing, a whole host of things. And the number they settled on, I think, was around 33%. So that means that 33% of students who start their course are not finishing. And some of the factors that were influencing that attrition rate were things that I deem to be preventable. So of course, in any program, you're always going to have necessary attrition. So this is the number of students who perhaps fail their course, or, you know, you're never going to get 100% completion rate, but 33% is way more than that necessary attrition rate. And the preventable reasons people were leaving were things such as finances or stress or mental health difficulties. And there was also another report by Health Education England that looked at the mental well-being of learners in practice. So that was thinking of medics and student nurses, a whole host of people. And again, what they were finding was that there were preventable causes of poor mental well-being. And these were things like cultural factors, help seeking, some of the things we've been discussing. So I think there's a whole moral imperative for us to ensure that students aren't negatively impacted by their course, and that they feel well and able to fulfill what they went into nursing for. You know, a lot of people enter nursing because they want to help people, and so it's really fostering that and letting them thrive in that environment. But we also have a more pragmatic issue of we don't have enough nurses in our current workforce to sustain the NHS in the form it is at the moment. So not only is preventing attrition in student nurses going to boost the workforce, however, it will also hopefully keep the nurses in if we can prevent poor wellbeing throughout their training, and then hopefully that would reduce the number of nurses who are leaving once they've qualified.
That's right, and this stuff around prevention is absolutely essential, I think, in this area, but also just in society in general, isn't it? We need to focus more on prevention rather than treatment of things. And of course, because nurses are a huge population of the country, aren't there? I think is it something around 700,000 registered nurses and midwives in the UK?
Right, yeah.
It's an enormous number, isn't it? So, nurses aren't like a small group of people in the UK. It's huge. So that's a lot of people's mental health and physical health and just well-being in general that we're thinking about here, isn't it?
Definitely, yeah.
Okay, so should we talk a little bit about the review that you did then, systematic review? Do you want to just talk us through? I suppose you've talked a little bit about the background. Maybe just talk about what you did and a little bit more about some of the specifics of because you chose to look at behavior change interventions as well as stress. So just talk about the sort of background to that and why you looked at that.
Yeah, absolutely. So just to say what a systematic review is, in case there's anyone who doesn't know. So essentially what we're doing is we're systematically looking at all the literature in a specific area to answer a question. So what happens is you will have a research aim, and then you'll create your method, and that will include your search strategy. So it will say the databases you're searching on to find your journal articles. It will say your inclusion and exclusion criteria, and it will say how you're going to extract the data. So when I was looking at interventions to improve the well-being of student nurses, I found there were so many out there, and there was many that had overlapping concepts. For example, resilience was poorly differentiated from well-being, or stress was poorly differentiated from burnout, for example. So it would have been impossible for me to systematically review all interventions that look at all of those different concepts. So I had to focus on one. And what I found was that interventions focusing on stress were quite well defined. So they had quite a good theoretical basis in some cases, and it was enough of a pool of research to draw from that I'd be able to meet my research aims. So I decided to consider interventions to reduce stress in the student nurse population. And I drew on what is Lazarus and Folkman's model of stress. Now, this sees stress as an appraisal or a relationship between the person and the environment. And this is the reason I chose that framework, because it's not saying that the environment doesn't matter, but it's also appreciating the role of the individual in that the way they interpret stresses, the way that they cope with stresses can have a huge impact on well-being. So what I did was I separated interventions into three categories. So we've got those that focused on stresses. So they are the things in the environment that create stress in an individual. We've got cognitive reappraisal, which is the way that individuals view those stresses. And then we've got coping, which is how individuals cope with the stresses they encounter. So when I started doing this, I became very aware that many of the interventions were focused on behaviour change. And I think it's really important to understand exactly how an intervention is having an effect. So this led me to draw on behavioural theory. And one part of behavioural theory is something called behaviour change techniques. Now, these are the smallest component of interventions that are observable, replicable, irreducible, and designed to change behaviour. So essentially things like demonstration of the behaviour, instruction on how to perform a behaviour, or behavioural practice and rehearsal. So what I then did was I not only separated the interventions into the categories I described before based on the model of stress, but I also looked at what behaviour change techniques they were using. And I think for me, that meant that when I came to analyse the findings, I had a really good understanding of what was effective in these interventions and what was less so.
I think it's a really important sort of finer grained distinction to make, isn't it? I think there's a big call within the psychological research community, which has been more sort of prevalent in the last 10 years, is to sort of dismantle specific components of therapies that are actually working. So we know that there's a big evidence base for well, particularly cognitive behavioral therapy for a range of conditions, tons of studies, but then it's a case of why, what is it specifically within a package of therapy that's working for people? And it's really nice that you went to that extra effort of going beyond just the review of do these things work for reducing stress, to what is it about these things which is working. And you found some interesting results with that, didn't you? So do you want to talk a little bit about I suppose just how many studies you extracted in this review, and there was quite a wide variety of interventions. So if you can just talk us through the sort of variety of interventions, that would be really good as well.
Yes, so I found thousands and thousands in my search strategy. And so I went through all of those, and I had one of my supervisors check the way that I was doing it, just to make sure that, I was making sort of empirically based judgments. So overall, the ones that met my inclusion criteria, there were 22 studies reported in 23 articles, and these were from a whole variety of countries. And there were, I think it was 1,638 participants were randomized, so that was the starting number, and there was a 93% retention rate, which means that there was quite a lot of data for me to work with. So in terms of the interventions, across the 22 studies, there were 28 interventions, because some of the studies analysed more than one intervention. And what I found was that most of the studies were aimed at coping. So 19 of the 28 interventions were aimed at coping alone. And so this included things such as mindfulness and meditation. We also had sort of some quite out there ideas, such as dark chocolate, like some people ate dark chocolate to see if that would help. I have to say the methodological quality of that study wasn't brilliant, but that was an idea someone had. We had other mind-body interventions like yoga, or something called auricular therapy, which is sort of needle-based therapy. And a lot of these did have a positive effect, but it was quite short-lived. So they didn't do a lot of long-term follow-up, and the long-term follow-up that was done didn't find the effect was sustained over a long period of time. Then there were very few studies looking at the stresses. So no study looked at the stresses in isolation, but some studies looked at like the stresses and coping together, or the stresses and cognitive reappraisal together. And they did find some positive results, but because they were so few in number, it was really difficult for me to conclude whether it was the stresses being targeted, or cognitive reappraisal being targeted, or the combination. And the ones that kind of spoke most to me, that I felt were really good, were the ones that targeted all three of the stresses, cognitive reappraisal, and coping. Now, only 2 out of those 3 studies found positive effects, but it's worth saying that the third study was a pilot study. And so that means it was based on a very small sample of participants. And doing some fancy statistical tests, they found if they'd had a larger sample, it is likely that they would have found some significant effects. Now, of course, that is very hypothetical, but I think it would be unfair to say that was unsuccessful, and there is the potential it would work. Then in terms of behaviour change techniques, there was quite poor reporting in terms of the content of the interventions, which meant that it was really hard for me to systematically code these techniques. So for example, a lot of them would have used social support, which is a behaviour change technique, but because they didn't specifically state this, I couldn't code it and be sort of confident in that. So the ones that I found were used most commonly were demonstration of the behaviour, behavioural practice and rehearsal, instruction on how to perform a behaviour, and bodily changes. And bodily changes is things like inducing relaxation. And most of these were successful. But again, the numbers were so small, I think these conclusions do have to be interpreted with quite significant caution. And I am calling for a lot more evidence in this area with really, really clearly articulated interventions, so we can understand these techniques a lot more.
Yeah, so it certainly sounds like there's some things missing in the research. And something that really did surprise me actually was you said there weren't any papers that looked specifically at targeting stressors, which is really surprising and shocking, isn't it? That no one has thought to look at, okay, asking, or even kind of like you have, asking student nurses what are the stresses, or working with organizations as well, and then targeting those to because I guess in some of the traditional, there are stress management approaches that look at obviously reducing stresses in your life, basically from helping the individual do that. And of course, there is some in the sort of organizational psychology literature, there are a few studies that I've come across that look in organizations at helping shift workplace-based factors, so basically helping reduce stresses. So yeah, there's definitely scope for future research, and I guess that's one of the big things you're calling for, right?
Yeah, I think as well it's worth saying there are some studies that look at stresses, but I was only including what's called randomized control trials in my systematic review.
Yeah.
So they are like what's deemed to be the top quality one. Now, of course, that is a debatable thing that's probably outside of this conversation, but that was the decision I made based on the number of studies that were there and the need for methodological quality when I was evaluating them. But there was like studies that was looking at reducing the travel to placement, but the methodology was so poor it would be really hard to trust those findings. So I think actually, you know, perhaps there is a whole wealth of literature out there on the stresses, but because it's not been done at such a rigorous or evaluated in a rigorous way, it's really hard for us as researchers to know whether it's whether they're helpful or not.
Yeah, and that's the sort of strange thing about research, isn't it? That even if it's published, it's sort of there's different quality of research, isn't it? It varies. So should we talk about some, actually, do you know, before we talk about some of the wider implications, another question I had was actually around cultural differences, because I obviously with the range of interventions, I know there were some more mind-body type practices, and I didn't look at all of the references of your study, but I was wondering whether you sort of perhaps just happened to notice, were there these stress management approaches, did you notice there tended to be any difference between studies that are published in certain parts of the world? Because I know it's sort of 13 countries, I think, you found studies from. So
yeah, I think what's really interesting is that if you look, there was a big review a few years back that looked at the sources of stress geographically to see if they varied. And they found they were incredibly similar internationally. Even though cultures and health systems vary, there was a lot of similar things that were coming up. And there's some seminal work by someone called Menzies from the 1960s. And they found some similar sources of stress to what's impacting students today, which is kind of, to me, saying, we really need to move forward with this, 60 years later, and we're still not really much more forward based on the research we had back then. But I think a lot more of the mind-body interventions weren't conducted in the UK. So mindfulness was more sort of Western in terms of it had been adopted by the US or the UK. But things like auricular therapy, which was that the needle points, that was based in the East. So I think there were definitely some geographical differences, but I think what's really important is that we learn from all these different places that this research is being conducted, particularly as similar sources of stress are found internationally.
yeah, and that's the importance of looking far and wide, isn't it? We shouldn't just be biased in, I mean, it's hard not to be biased by things published in the English language, but yeah, it's certainly looking to the East as well as the West. All right, so should we talk about the sort of practical implications then of the research you found? So perhaps you could just talk a little bit about, I mean, you've sort of mentioned a little bit from a research perspective, but also on a practical level with individual student nurses, education institutions. What's the sort of relevance of your findings here then?
So I think, firstly, based on the evidence I've been able to access, it seems that improving coping is going to be beneficial, whether that is short-term or long-term. So I'm not completely excluding the need to support students to develop those coping skills, because you could have as many resources and organizational perfection as you like, if such a thing even existed, but an individual will still experience stress if they feel unable to cope with the demands placed on them. And doing a higher education degree is hard work, like it is really challenging. And I think although these conclusions are tentative in terms of the benefits of coping due to like the long-term follow-up or the poor methodological qualities, I'm pretty confident that the volume of literature I found in this area means that I can confidently say an intervention would benefit from including coping within it in some form. But, and this is a huge but, we also need organizational change. I feel like this has been neglected for too long. So I think it's unfair to place the onus solely on the individual. And I don't think we've explored enough the organisational impact of student nurses working in the culture that they might experience, and with the resource constraints that currently exist, or the structure of programmes where academic and clinical work overlap, or where students are struggling financially, so they're having to take on part-time jobs, or they have caring commitments, or they have a disability that means that they struggle in other ways. So I think although my review did support coping, the reason for that is because there just wasn't the literature in the stressor focused interventions. And I think for me, that is the real world implication, is that I really hope in the next few years we get some more stressor focused things coming out to hopefully be able to show that we need a multifaceted intervention that appreciates the individual and appreciates the environment in line with the transactional model of stress.
And the work that you've done as part of your PhD is, I guess, an effort to address that, right?
Yeah, absolutely. So in my PhD, the most important thing has been stakeholder involvement. So that has been from the very word go. I have talked to students, academics, educators, policymakers, nurse leaders, those who are part of the Health Education England, who help run nursing programs. I've tried to make sure I speak to as many people as possible to see what we can change organisationally in a way that is feasible, because I don't want to come in with some huge organisational suggestion and then for people to say, well, that's just not pragmatic, so we're not going to do anything. It's getting that balance between what do students need and what is practical within our current systems we're working in.
Yeah. And also there's going to be differences on a local level, isn't there, with resources and the buy-in of different stakeholders and the particular local needs and sort of populations they have. So it's again, it's flexibility is really important, isn't it, as we were discussing before.
Yeah.
Okay, and I think, just to finish off, do you want to just talk about what you're going to be doing next? So you mentioned you had a job interview, actually.
Yes.
You don't have to tell us where or anything for confidentiality, but what do you hope to do? You're finishing your PhD soon. Tell us about what you'd like to be doing next, what your plans are.
So my intermediate aim is to publish my findings, because I really would like to share them with the wider community and to show the student nurses and the academics and educators who have contributed to my PhD. They've given me such amazing insight that it would be a shame for that to not be shared. So over the next few months, I'm hoping to publish. And then going forward, I want to extend my research and my research skills and become a more independent researcher. I'm also really keen on lecturing, because I've done some lecturing throughout my PhD, and it's meant I've been able to apply my findings directly to the student nurse population, which I think in a programme such as nursing that has such a big practice component, it's a really, really great way to make sure that the research I'm conducting is really relevant to the current health system. So my plan is to get a research post or a lecturing post and develop those skills in order to ensure that I continue to contribute to improving the workforce of the NHS, because I really think, you have some incredibly special people who are trying to do their best for patients, and I'm just really passionate about ensuring that they're cared for as well.
Such valuable work, and I'm sure you'll be a real asset to whoever you work for, and it's such a pleasure to talk to you about this stuff. And need more people doing it, don't we? Need more people doing the research, but also then kind of translating that research into policy and actual change.
Definitely. Well, thank you very much for having me. It's lovely to have the opportunity to talk about it.
Yeah, no problem. I've actually got one last question I want to ask you. What you obviously, having been a student nurse yourself, and there may be some student nurses listening to this, do you have any advice for sort of nurses who are early in their career?
I think most importantly, we've spoken about this slightly, but it's the self-compassion piece. So I think the Dr. Seuss thing that everyone always says is, you are you, that is truer than true. No one else can be youer than you. And I think that is the thing, like sometimes when you're overwhelmed by life or by your course, or you've failed an assignment, or you've made an error in placement, or whatever, you can feel like you're a bad person, or like the whole world is is going wrong for you, when actually like you are your superpower. So I think it's to really like work on your identity and your authenticity, and just to make sure you spend time caring for yourself, because you can get so caught up in caring for other people that actually you forget, you know, you can't help others if you don't help yourself first. So I think for all members of staff, whatever stage of career they are at, I really recommend that self-compassion piece.
Brilliant. Thank you. Thank you once again for joining me on the podcast.
Thank you for having me.